Welcome to the Hindu's webinar on GBS. A rare autoimmune neurological condition, Guillain-Barré Syndrome has recently been making headlines across the country. Over 200 cases have been reported from Maharashtra, with 9 deaths linked to the syndrome so far, while 2 suspected deaths have been reported in Andhra Pradesh, 1 in Telangana, and other states, including Karnataka, have stepped up surveillance. Guillain-Barré Syndrome, or GBS, causes the immune system to attack the peripheral nervous system, causing weakness in the muscles and, in some cases, paralysis. While the National Institute of Virology has confirmed that contaminated water was the main reason behind GBS in parts of Pune, other cases are still under investigation. Today, we are joined by Dr. Subramanian Swaminathan, Director, Infectious Diseases and Infection Control, Gleneagles Global Hospital, Chennai and Bengaluru, and Vice President, Clinical Infectious Diseases Society of India, to decode the GBS outbreak for us. Audience members, this is a Q&A session, so please feel free to post your questions. Welcome, Dr. Subramanian. Thank you for joining us.
Absolutely pleasure being here.
Doctor, could you explain to us what GBS is?
So GBS stands for Guillain-Barré Syndrome. Two French researchers were the ones who identified and described this actually. Basically, when it's a very crudely put, it's our immune system going wrong. In that, when we have an infection or some other challenge, in those days vaccines are big, our immune system kicks in to fight that. But unfortunately, when the immune system kicks in, it also forms certain antibodies which can be damaging for us. And those antibodies can go and start attacking parts of our own body and cause harm. So what happens in Guillain-Barré syndrome basically is that we have an infection that happens, or some other event like older rabies virus. Immune system comes in. It may or may not be effective in handling the problem, but the problem goes away by itself. But now the immune system is now causing mischief in the brain, where it goes and attacks the glial cells, the myelin producing cells, and the myelin gets damaged. And when that happens, there is neurological damage. And the extent of neurological damage is difficult to assess because for some people it can be minor, for some people it can be life-threatening. And this is something that can be pretty scary.
You said that it was almost always caused by an infection. What kind of infections cause it?
Today, we are primarily thinking of infections. About 30 years ago, one of the commonest problems with the rabies vaccine, because we used to use neural vaccines and they used to cause demyelinating disorders. Today, our vaccines are vaccines. So the major cause of GBS today almost always is infections. And when we say infections, many different infections can trigger a GBS. Although the most common and the most often identified culprit is an organism called Campylobacter. It is something that causes gastrointestinal infections, and worldwide it has been shown to be an important trigger for Guillain-Barré syndrome. So this is out of proportion to any other pathogen in terms of triggering GBS.
So this is one infection, but there are others also that can trigger it?
Absolutely. Absolutely. We are only limited by the imagination of what all can trigger it. Obviously, it's basically molecular mimicry in that these bacteria have proteins in them which we call antigens. And the body's immune system makes lymphocytes which will attack those particular antigens. But some of those antigens can look very much like our myelin protein, what we have in the brain. So when you form antibodies which are very effectively attacking this, it may also end up attacking here. That's basically what it is. So there are different bacteria or even viruses which can trigger, but those are very rare. Overall, when we look at it, the majority of it seems to be today related to.
Tell us, doctor, not everybody who has a bacterial or a viral infection gets GBS, right? Why does it affect some people only?
Thank God for that, isn't it? Because if you have everybody developing GBS, man, that will be a catastrophe. But it's a very scary illness, to be very honest. So, as I said, it's a bit of molecular mimicry in that you have an antigen which looks surprisingly like something we already have. And you form a white cell with an antibody which can attack this and also attack. So, obviously, there's a lot of permutation and combination which goes into it for it to happen that way. So, therefore, the majority of people who form that we may not have a very good fit with the brain protein. So in that case, they're not going to have a problem. But for the unfortunate person who by random effect develops the antibody which can do this, they are ones sorry, they are the ones going to end up with the possibility of Guillain-Barré. And therefore, there's a lot of chance involved. That's probably some amount of genetics also involved because it also depends on the way our immune system is coded. That's not something we can predict that easily. So our ability to predict who will and who will not develop GBS is still in a very early phase. And because it's such a rare disease, for us to be doing large-scale testing doesn't make sense. It makes more sense for us to prevent the trigger rather than find out who's the risk. So, I mean, so all the focus has always been that. But again, yes, it is possible that there may be some people who may be doing this. But again, we don't have good tests to find those kind.
If this is a rare disease, like you said, doctor, that means that the cluster of cases that we're now seeing in Pune and Maharashtra and a few other parts, far more people were actually infected with the bacteria or virus than the number of people who've shown up with GBS, correct?
Absolutely correct. Absolutely correct. So please understand that the GBS attack rate is, a couple in 1,000 or less. It's a very small number. So for that many people to be identified, the contamination level has to be astronomically. I am not sure why people are so surprised by this. The quality of water has been steadily deteriorating across the last few decades. The government has made a lot of efforts. Let's not, part at the government for everything, because all this idea of Swachh Bharat Abhiyan is actually very good. I honestly believe that's an important step towards making us better, more healthy, and having a better quality of life. But the unfortunate part is that water quality in major metros has become a significant issue. How do we know? A couple of years ago, there was a large study looking at typhoid in children. And what was reported was that there is an excess of typhoid in children, especially those who live in metro areas. And incidentally, one of the largest centers for this was Pune. And they found that in Pune, there was a very high load of typhoid in children. Now, every pediatrician will tell you that they are seeing a lot of typhoid today than ever before. So that basically tells you that water contamination is a significant threat across India, and probably more so in certain areas compared to others. So therefore, what is happening is that our water quality issues have not been addressed for a very long time. Now, when did Campylobacter creep into this is very difficult to say. Let us say that we have been suffering with stool-related bacteria for a very long time, but we've been lucky enough to avoid Campylobacter all this while. We may not have seen significant amount of GBS. But on the other hand, if we develop Campylobacter jejuni into the water system now, then that would certainly explain an explosion of GBS cases in the current setting. Also keep in mind, it also has to do with not just acquisition of water, but also treatment of the water. And the safety of the piping system and so many other things. See, this is not new. We go back in history and we look at what John Snow did with regards to the cholera Broad Street pump. It's an example of how epidemiology is to be done and how public services need to cooperate evaluation and go back and fix problems. Unfortunately, I think there's not been enough effort put into safety measures, and I think we are paying the price.
Tell us a little bit about how you know you have GBS. I believe some cases can come on gradually, and in some cases there's a sudden onset of symptoms.
Absolutely. So, GBS is a disease which has a huge spectrum of presentation. So you can have a patient who's got a mild problem, and then you will little bit painless, but the patient may not proceed further. They are the lucky ones who are going to get away without that problem. On the other hand, you may have patients who have extensive demyelination and they have severe problems, meaning there is damage to multiple areas of the nerve system, in which case you can have paralysis, which is ascending upwards and going up to the brainstem, and they may have difficulty with their breathing muscles, swallowing, and those are patients who are at very high risk because that can literally kill the patient. Now, again, so there are two problems. One is the tempo and the other is the peak. So you can have patients who proceed very, very fast. You can have patients who proceed very slowly. Why is this difference important? In patients who are progressing fast, you need to act very quickly because the time window is extremely limited. Because even if you make an intervention, it takes a few days at least for the benefit to kick in. You can't say, I give steroid today, maybe I give today, tomorrow is going to be better. It'll take at least 24 48 hours for you to start seeing the difference. So the velocity is important. If they're moving very fast, even more important for you to do something emergently, kind of hold the patient back and make sure they don't literally collapse. So if the person is moving more slowly, we have a better time window, and therefore we can try something simple. Then if it doesn't work, go for something more complex. The second thing is the peak. Is that if the patient is, generally speaking, slow moving patients don't peak very much. If they are having very mild disturbances and things like that, they can manage even in the ward and simple things, they're going to get it. But the ones who have severe defects, like breathing difficulty and brain stem weakness, throat problems, swallowing problems, these are the patients who get into trouble. And these patients are sitting ducks for secondary infections, which are usually the most important cause of death in these people. Because they are on a ventilator, they get long lines, they end up in the ICU for weeks on end, and they are very high risk for hospital-acquired infections, which can be deadly. So obviously, each patient goes through a different kind of illness. No two patients are the same. The treatment protocols are by and large standardized, but picking them up very early is absolutely key. The earlier you pick them up in the disease paradigm, the better the chance that you do something meaningful.
Picking them up early means that we should know what the signs and symptoms are, correct? How does it normally start, doctor?
So, usually it starts with a little bit of, in GBS, it's predominantly motor. In that, it's a problem of muscle weakness. So, when we talk about neurological illnesses, there are many domains in neurology. There is the sensory system, there is motor system, there is the autonomic system, which is basically your urination and your bowel movements and heart beating and things like that. There's also the sensory system, so there are special senses, the hearing and the vision and things like that. Then we have your balance. So, GBS is something that primarily affects your motor system. In that, it causes an inability to move the muscle. The nerves, the peripheral nerves are vital, but the nerve impulses from the brain are so delayed, they do not go down and activate the muscle to move. So what happens is that they start off with muscle weakness. The leg may start feeling very plain. They may not be able to support themselves. The legs start barking. And it's a muscles up. You start having weakness in the hips, then in the trunks, then the arms, and then you start having weakness in the throat and difficulty breathing. So generally speaking, it doesn't suffer from the feet up. Again, there are variants in this which may behave differently. The most common one is something that starts in the leg and moves up. Again, you can have mild other things like tingling and things like that. But generally speaking, there is no sensory loss. So if you touch them, they'll be able to perceive that. They'll be able to make out hot water, cold water, all those things. What is generally is the motor system.
Let's circle back a little bit to what you talked about, the necessity for hygiene and sanitation to be better, doctor. Is that the primary way, do you think, of preventing these clusters of cases from reoccurring?
Well, at this point, we are in the crisis mode, and therefore it should also be about case finding and early diagnosis and treatment, because we don't want patients coming in extremis. Like they should come in first paralyzed and with muscle respiratory paralysis, where it puts a strain on the system, where you have lots of patients on ventilators and things like that. So obviously, we need to educate the public at large. If you have symptoms like this, go see a doctor as soon as possible and make sure you get checked out. So that education has happened, unfortunately, so that people come in early and we can prevent unnecessary prolonged hospitalization costs. So that's the first one. The second part is obviously bad. We need to cut the head of the demon. And here, it is very clear that the water is not. Numerous data sets, again, the quality of the data sets can be questioned. Numerous data sets seem to suggest that it's a waterborne. Based on history, based on the past outbreaks and things like that, we know that it's most likely going to be water. Could it be something new? That's always possible. But the probability is very new. So we need to aggressively start looking at water safety. You need to start hyperchlorinating water, make sure that the water transmission systems are properly maintained, make sure there's no leak, because you may be chlorinating them at the point of ingress into the water system. But if the water pipelines on the way gets contaminated with sewage or something like that, then it makes a mockery of all the effort that you put in. So obviously they need to do water sampling and testing at various points to find out exactly where it is. But again, this is where epidemiology helps to understand where the clusters are. If the clusters are all over the place, then you have a problem. It's a widespread problem. On the other hand, if there are clusters in specific areas, then obviously it's not a central water problem, but rather the water transmission problem. And you need to assess where the problems are and fix it accordingly. Why? We need to teach our families that, guys, please boil your water. And or if you have a system, then use it, but boiling is always safe. Do not consume water and water-based products, things like that from outside. This is probably not the type of honey we all love fast foods. Normally, I say, I enjoy fast food, but not the time for that. So probably eat at home, definitely you should stay at home, but avoid eating outside, especially water and water-based products. You don't know where the contamination is. So for now, keep it down. But at the same time, the public health officials need to go on high gear and try and improve the quality of water distribution. That's what is most important.
Again, circling back to something you mentioned earlier, Doctor, there has been a little bit of speculation on social media of the link between vaccines and GBS. Could you decode that for us a little?
Oh, that's important. So we have had demyelinating disorders in response to vaccines in the past. Please understand that rabies vaccine today is not what we have. Because I lived through the days when we had the older rabies vaccine. Those were pretty scary vaccines. Today's rabies vaccine is an incredibly effective, very brilliant, very, very safe vaccine. But those days, we used to culture the rabies virus in brain tissue and create the vaccine there. So basically, the vaccine contains brain proteins, the myelin. And if you inject it, you are basically triggering the immune system with antigens which are not supposed to see. What do? They get ready to post later. It was very scary. But today we don't have. So today for vaccine-related GBS, doesn't happen? Yes. But vaccine-related GBS is probably less than 1 million. Now, how do we know this? We don't have very good policy reporting in India, but many countries have excellent reporting systems. In the US, all vaccine manufacturers contribute financially to a system called VAS, Vaccine Adverse Event Reporting System. In that, if somebody is harmed by a vaccine, the government has resources to reimburse them. Not only the care taking it, they also reimburse financially. So there is an incentive towards reporting adverse effects from it. So that people pick it up and there is an alarm to be made and alarm is made. When you look at the rare system, you realize that it's actually quite rare. It's actually very, 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 very rare. So, in fact, this kind of immune triggering can happen not just with GBS, it can happen with many other things. If it's an immune triggering which causes GBS, it could be a threat for patients with other medical disorders like rheumatological disorders. But when you look at what the society is saying, the American Rheumatology Association is very clear. It says even for patients with immune-based disorders, the vaccines give you more benefit than this, and therefore they're very clear saying please take vaccines which are appropriate for you because the benefit far outweighs the risks. The only patients where we are careful about vaccinating are people who have a past history with Guillain-Barré syndrome. If they had a past history with GBS, we will ask how did it happen, what happened. So if they had a vaccine-related GBS, then yes, vaccinating them may be great. But if they had an unrelated GBS, giving them the vaccine is absolutely not. And most of us would be comfortable giving that person vaccine because the benefit of vaccine far outweighs any possible risk. And I think this concern of vaccine-related GBS is massively being overlooked. let me be very clear and say that vaccine-related GBS is a rarity, does happen, but it is so rare. It's like looking for a zebra in the middle of Chennai city. So no, not something I'm going to do.
Thank you so much for speaking to us today, Doctor.
Absolutely.
Okay, thank you. Bye-bye.
Take care.